Good afternoon, ladies and gentlemen. I'm W��涵, and I come from National Cheung University. Today, I will be presenting some ideas about the cost-effectiveness of syndromic management for male STD patients with urethral discharge symptoms and genital ulcer disease in Taiwan. Recently, sexually transmitted disease, STD, are a major global cause of acute illness, infertility, long-term disability, and death in worldwide. WHO has estimated that 340 million new cases of syphilis, gonorrhea, chlamydia, and trichomoniasis occurred globally in 1999 in men and women aged 15 to 49 years. Control of treatable STDs can be achieved by case detection, management, and by behavior change interventions. In industrialized countries, case management is usually based on laboratory-confirmed etiological diagnosis. However, in some settings, laboratory tests are frequently unavailable due to laboratory equipment deficiencies, limited clinical training of laboratory personnel, and poor financial resources. Consequently, syndromic criteria have provided a rational approach to ensure prompt management of STDs. Although studies in several countries have demonstrated that syndromic management is effective, but current clinical practice in Taiwan combines presumptive treatment and laboratory tests. Providers do not defer treatment until after laboratory tests are available. On the basis of the reasons mentioned above, the purpose of the present study today is as the following: assess the cost-effectiveness of syndromic management protocols for the treatment of STDs in comparison to both the current method used in Taiwanese STD clinics and the etiological approach. Materials and methods. The study's time period is from July 2004 to June 2005. Subjects were all male patients attending two outpatient clinics. The first one is STD clinic of Taipei City STD Control Center, and the other one is genitourinary outpatient clinic at a Kaohsiung Primary Care Service. The criteria of subjects listed 5, including male patients with genitourinary symptoms, age 17 years old or older, sexually active, able to provide urine and blood specimens, no use of antibiotics in preceding 15 days. The participants were asked to complete a questionnaire containing demographic information and genitourinary symptoms. Genital examination was performed by a doctor, and their blood samples were tested by Treponema pallidum, and their urine specimen were tested by Chlamydia trachomatis and Neisseria gonorrhea. Amplicor PCR test for Chlamydia trachomatis and Neisseria gonorrhea. The RPR and VDRL test was used for syphilis screening, with confirmation by TPHA following the manufacturer's instructions. In this study, only direct expenditures for medical care, include costs and charge for outpatient service and medications, were analyzed. The cost of the current and etiological approach included the following 5: amount paid for laboratory tests, physical examinations, drugs, materials for health education, condoms. And the cost of syndromic management included the following 4. Comparing to the cost mentioned above, there is no amount paid for laboratory tests. Costs presented have been converted from their original figures to 2005 US dollars using the Taiwan Consumer Price Index from the year in which the original cost was incurred. Statistical analysis included SAS software and Excel spreadsheets. Definition: correctly treated was defined as correctly diagnosed and who were given appropriate drugs. Overtreated was defined as no infection and treated for infection. Incorrectly treated was defined as mistakenly treated for another infection with drugs. Sensitivity was defined as the proportion for people with disease whose assessments for the disease were positive. Specificity was defined as the proportion of people without disease whose disease were negative. PPV was defined as the probability of disease in a patient with a positive assessment. The study's results. Figure 1 and 2 provides the outcome outcome of patients with urethral discharge symptoms algorithm and the outcome of patients with general other disease algorithm. There were 335 patients had urethral symptoms. Of the 241 patients with urethral discharge, there were 138 patients had genital ulcers or sore with rash. Of the 112 patients with ulcer discharge. This table presents the sensitivity, specificity, PPV of the syndromic classification, and their PPV are 56.4% and 23.2% respectively. Of the current approach, their PPV are 60.4% and 70.2% respectively. This table provides the total cost for STD treatment by 3 approaches and their correctly treated numbers, so we can work out their cost-effectiveness ratio by these 2 figures. For the treatment of urethral discharge, the cost-effectiveness ratio for syndromic management is minimal. So it means that the syndromic management is the best approach, and their average cost per correctly treated patients with urethritis only $3.86. For the treatment of genital ulcers, the cost-effectiveness ratio for syndromic management is minimal too. So that means that the syndromic management is the best approach too. And the average cost per correctly treated patient with genital ulcers only $10.47. In conclusion, the results of the study indicate that the use of syndromic management for men with urethral discharge and ulcers is a simple, cost-effective approach in developed countries such as Taiwan. So therefore, we should suggest health authorities implementing this approach in resource-rich areas, especially in primary health care levels in rural settings. The above are my today's presentation, and these are references, and thanks for your attention.